meatus?
Concha.
The meatus is the opening.
Oh.
The concha is this, actually the bone. See, this bone, concha is bone. This just shows the mucous membrane over the bone. That's bone. That's the turbinate bone or concha bone. This is part of the ethmoid bone.
Okay.
Let's see, wait a second here. Bingo. Bingo.
Oh.
These are all the ethmoid sinuses.
Mm-hmm.
Yeah. See, you taught me some good stuff here. I didn't know that was there.
Yeah.
My students teach me so
Right
much
here.
every day. I'll let you do it. You can see better than I can.
Oh,
I'm hoping I get these cataracts done in December.
you're going to get them done
Yeah,
in December?
I've already scheduled. Okay. Did you understand that?
Mm-hmm.
Okay, here, this is the larynx, and it would be situated like this in me. Just like that. Okay? And this is your hyoid bone, that's right here. This is that epiglottis. Remember, when you swallow, what it does, it folds down like that. Okay. Then as you come down, this is your thyroid gland here. And this is your trachea. And you'll notice, and this is your esophagus. Notice how, oh, here it is. Notice here's the esophagus. It's behind the trachea. And here's the trachea. And remember, the trachea is open.
Mm-hmm.
Posteriorly has the trachealis muscle, which allows the food to bulge in there. Okay? All right. I've got that. And of course, you know I'm going to have to show you something on the heart. This would be the pulmonary trunk, pulmonary arteries, pulmonary veins, you know. So here we are. This is your hyoid bone up here. Thyroid cartilage. Your thyroid cartilage is this cartilage right there. Can you feel that? It's right there. See, I can move it back and forth.
Yeah.
Yes, see, that's your thyroid cartilage. Okay. Right below that and along the side is the thyroid gland. I don't know if you've ever had the doctor put their hands there, swallow. That's what they were feeling. Okay. This is the trachea. Notice it goes posterior to the great vessels. Here it comes down here in the mediastinum. It bifurcates at something called the carina and makes a Y. The carina, though, is right there. That would be the carina. You see? Okay. The right mainstem bronchus, the left mainstem bronchus. This divides into the secondary bronchi. There will be 3 on the right because you have an upper lobe, a middle lobe, and a lower lobe. On the left, it'll go into 2 because you have an upper and a lower lobe. All right? Now, when you get out here, these are tertiary, and on the right side, you're going to have 10. On the left side, you're going to have about 8 because, remember, there are only 2 lobes here versus 3 lobes. See? So this is right lung, upper, middle, and lower. Upper, middle, and lower. On the left side, it's only going to be 2 lobes. Notice how prominent the blood vessels are. Look here, this is the pulmonary vein. Mm-hmm. And this is the pulmonary artery. Mm-hmm. Remember, that's the only place where it's swept
reversed.
Around.
What is this?
Oh, this is the diaphragm, excuse me. All this is the diaphragm. That big muscle comes down.
Because you have a sticker here and one up here.
Maybe I ought to take that one away then. It's kind of confusing, isn't it? There you go. You know where it was? It was on the esophagus.
Oh.
That's where it was. That's all right.
Let's put it back.
Don't worry. I've shown you all. Yeah, put it there. That's where it was. It slipped down. It's good to have good help. I bet you take care of everything very nicely. You know, I was just saying, women are so much more neat than men.
That's what my boss told me today.
Oh, really?
I was really organized.
But women do that, and we're so blessed we have women. Sometimes we don't treat them good enough, but we are. See, there's upper, middle, and lower. And this is the upper and lower. This is the left side. That's the cardiac notch. Mm-hmm. And this is going to show you the pulmonary outflow tract. This is pointing to the interosseous muscles. Now, there's no way you can tell if that's external or internal. It's just interosseous. Of course, here's the diaphragm. And the last here.
You have another sticker as well. It's in here. In there.
I think that's another folly down. Yeah, I think that's what's happened.
So that's going to be on the esophagus again?
Probably the esophagus. Either that or the thoracic aorta.
Okay.
But that's going to pick that out. Here we go. It's either it'll either be the thoracic aorta or the esophagus.
Okay.
Okay, y'all see that? Did you see that? Okay. I'll call her eagle eyes. I hope when I get my cataracts done I can see better again. I'll do that in December.
I think you will.
Oh,
You're worried?
yeah.
It's a major surgery.
Well, anytime you operate on somebody's major,
Mm-hmm.
Right.
I'm going to tell you. I remember one time we did 2 vent tubes, which is just simple mask. No intubation or anything. And I did a radical neck after that, which is a big case, head and neck cancer case. We had laryngeal spasm on both of those kids. I mean, they did all right, but that's always a little frightening when they turn kind of blue on you.
Mm.
And you have to break the spasm of the vocal cords, called laryngospasm. And
How do you
the
break
guy
it?
you bag them with positive pressure.
Oh.
It will break.
Oh, cool.
Now, sometimes you have to give them an IV nectine, which paralyzes them. But that's not what you would do in something like that. Anyhow, the head and neck cancer case didn't turn a hair. He took half his head off and didn't turn a hair. Okay, here's that same tube going up to your ear. There's your epiglottis. Now we need to get this straight. The bottom one is the vocal fold, the true vocal cord.
True vocal.
Speech.
Mm-hmm.
The above one is the protector. So it's got to
The
be
false.
above it.
Mm-hmm.
That's the vestibular fold or false vocal cord. If I'm going to protect you, I have to stand in front of you, don't I?
Mm-hmm.
Not behind you,
Mm-hmm.
unless you're protecting me, So that's the way to remember that. The false cord is going to be superior, protecting the true cord.
Okay.
I can't tell you how difficult that is. Always something difficult for students to get straight. But that's the way I've found the best way to think, protect you, how it protects. Okay?
Yeah.
All right. You two study together?